So parents have to understand that this ideology, this belief system, has no foundation in medicine or science. It is similar to a religion. Now, religions are fine. Religions are wonderful most of the time, but they are not science and they are not medical, and they should not be presented to children as fact.
Today on PMA News, Lisa Johnston had the distinct pleasure of welcoming Dr Miriam Grossman, a renowned psychiatrist whose groundbreaking work in mental health advocacy has transformed the way we approach wellness and resilience. With an unwavering commitment to evidence-based practices, Dr Grossman has dedicated her career to empowering individuals with the knowledge and tools needed to navigate life's challenges. An author of several influential books, such as Lost in Translation, and a sought-after speaker that has made a guest appearance on the Matt Walsh documentary, What is a Woman? She continues to enlighten and inspire with her profound insights into human behaviour and emotional being. Now please join us in giving a warm welcome to Dr Miriam Grossman.
Hi, Lisa. How are you?
Very well, thank you. Thank you so much for joining me today. My first question today is, when did you first start to see that the medical system had begun to transition children at an extremely young age, higher than normal rate? And what were your initial thoughts and reaction to this phenomenon?
Well, I think like just about everybody else, I never would have expected such a epidemic of young people suddenly announcing that they were identifying or seeing themselves as something other than their biological reality. I certainly never would have expected that when I was in medical school, when I was, training to become a psychiatrist, and then after that, a child and adolescent psychiatrist. The psychiatric condition that was known as gender identity disorder was extremely rare. One in many, many tens of thousands of young people, children, adolescents, and adults as well. Extremely unusual. And so I never imagined, and neither did my friends, my colleagues that I was studying with, that we would see such even one child in our entire lives who had this condition of rejecting their biology, rejecting their physical reality. And now we're at a point, as you probably know, Lisa, in which we have epidemic levels. There's an increase, at least in many Western countries, there's an increase of such, identification of something other than your sex, your biological sex. There's been an increase of about 5,000%. And, most people either have someone, in their immediate or distant family, or, they know of a family in which there is a young person who is wanting to present as the opposite sex. And so it has just exploded and skyrocketed.
So you weren't the only doctor within your practice or close by that felt the same way. So how do you think that the doctors who do condone this and even encourage it and go ahead with it, where do you think they are initially making that decision from? Is this a money thing, would you say, that it all comes down to, or do they truly believe in what they're doing?
Well, Lisa, I actually wrote an entire book on this subject. And the name of the book is Lost in Translation. And I'm just going to hold it up here and show it. It's a new book, just came out last year. And it's a guide for parents, regular moms and dads, to answer precisely those kind of questions that you're asking me. Where did this come from? How do we understand it? Why is it that some doctors are really advocating and promoting this idea of affirming gender affirming care. And the reason why I put it in quotation marks is because it's really an Orwellian term, because when we're affirming, that means we are affirming an untruth. We're affirming something that can never be. So if there's a girl who's insisting that she's a boy, parents take her to a gender clinic, a gender affirming therapist. That therapist is going to tell the parents that they need to allow her to be in the driver's seat and to be in control. So if she states that she is a boy, that means that that identity must be honored, and that everyone should be using her new name that she has picked and the new pronouns. If she wishes to block her puberty, then the parents need to sign on the dotted line. That is called gender affirming care. And it is really probably definitely one of the biggest, if not the biggest, medical scandal in history. And in fact, it's really unraveling as we even speak. And what I mean by that is that even today, I mean, I know it's 6 a.m. for you, but for me, it's 4 p.m. So, I've been following the news today, and I've been following a lot of different people on X that are reporting on updates. And I can tell you that there's an organization, a very prominent organization called WPATH that you may not have heard of. It stands for World Professional Association for Transgender Health. It's an international association. They present themselves as if they are a professional medical association based on evidence, based on science, produce standards of care for transgender individuals. WPATH has for decades been the go-to organization for doctors, therapists, hospitals, clinics, and courts as well to turn to with any question of how do we help people who are struggling with their identity, their gender identity, wish to go through medical and surgical procedures in order to appear as the opposite sex. So it's really WPATH that has been, or at least, has presented themselves as if they are the authority. And what's happened recently, just in the past few weeks, is that some material has been made available from WPATH's discussion boards, private discussion boards, in which the clinicians are sharing their concerns with one another. And it's clear from those discussions that they are aware that what they're doing is experimental. What they're doing has really no solid data behind it, no solid data that shows long-term benefit. They are concerned about the possible harm or the actual harm that they have inflicted on their patients. They're reporting on all sorts of difficulties that patients have, surgical complications, emotional complications. There's a report of somebody who passed away from liver cancer that it was presumed to be a result of being on estrogen for many years. You have to remember, and I want your audience to remember, that the individuals that are receiving so-called gender-affirming care, hormones, cross-sex hormones, puberty blockers, and surgical procedures, are physically healthy individuals when they start off. These are not people who have underlying medical problems. You know, they don't have any problems with their reproductive system, with their hormones. They don't have any a problem with their nervous system, with their brain, or anything like that. They are 100% physically normal. And then they go in for these treatments and they end up acquiring a lot of medical problems. Some of them may be fatal. And so
Lifelong as well, isn't it? All of
life,
these.
well, of course, you become a lifelong patient, obviously, because in order for a woman or a man to present, for them to physically appear more like the opposite sex, they must take opposite sex hormones for their entire lives. Okay, so that's also, people I think lose sight of that. But they do become lifelong consumers of pharmaceuticals. And from what I understand, each child that enters the system uh, and is put on blockers, and then almost 100%, 95 to 99% of kids that are put on puberty blockers then continue on to cross-sex hormones. And if they continue for the rest of their lives on these hormones, not that everyone does, because there are people that we can talk about those people later, but they decide that it was a mistake and they stop. But for the ones that do continue, they are worth about $1 million each to the pharmaceutical system, and that is not counting the cost of very expensive surgeries.
Wow.
So, yeah. So what I just wanted to say about WPATH is that this organization that has been held up as the eminent authority on treatment of these individuals has been exposed, and I also exposed them in my book. I had quite a bit of material within my book that exposed WPATH as an advocacy organization, not a medical organization, but an advocacy organization. What are they advocating for? They're advocating for medical and surgical transition, not a word that I like, but I'm forced to use it, transition for anybody that wants it, regardless of age and regardless of mental health status. There should be no obstacles, no gatekeeping, what they call, for anyone that comes in to a doctor's office, a quote unquote affirming doctor's office, and says, I want estrogen, I want testosterone, I want my breast removed, I want my uterus removed, I want a penis constructed, I want my penis turned into a so-called vagina. There should be no gatekeeping whatsoever. That is what WPATH stands for.
And this is happening on a mass scale. I personally, as well as all of that, blame the mainstream media, of course, and we're seeing in even school libraries these days that they have superhero trans kids books as well, readily available for children to borrow out of these school libraries. This all comes from planting the seeds of these confusing ideas into children's minds at a young age. Can we talk a little bit about that, where it all starts?
Oh, Lisa, that is so important. You probably have many parents in your audience, and I just want to warn parents that they must inoculate their families against this epidemic, and they can do that. Okay, and one of the reasons for my book was exactly that, to teach parents how to do that. So parents have to understand that this ideology, this belief system, has no foundation in medicine or science. It is similar to a religion. Now, religions are fine. Religions are wonderful most of the time. but they are not science and they are not medical, and they should not be presented to children as fact. I mean, many of us believe that we have souls, and many of us want our children to believe that as well. That doesn't mean that the idea should be presented to them in public schools as a scientific fact. But what is happening in our schools and in our libraries, as you mentioned, and certainly entertainment and, you know, Hollywood and our base almost everywhere, we are being, and children are presented early on with the idea that it's possible to be born in the wrong body, and that there's something called sex, which is your physical reality, but there's something else called gender or gender identity, which is kind of a psychological sex, or a sex that's in your head or in your mind. And kids are told that sometimes those two things are not in congruence with each other. Sometimes they're at odds. Have a person who feels like a girl but is born into a boy's body, are mistakenly assigned, that's the word that's used, assigned to be a boy, whereas the truth is, the inner truth of that child is that he is a girl. And so this very dangerous idea is presented to young kids, and kids who aren't even old enough to read, kids who are these are books that have been written for ages like 0 to 3, to be read by adults to kids that may not even be able to put a sentence together. And they are saying things like, when you were born, the adults made a guess about who you were. And that guess may have been right, but that guess may have also been wrong. And if they guessed wrong, well, so you need to stand up and tell everybody who you are. And everyone is obligated to accept who you are, who you say you are, who you feel you are, even if that may change, because they say, gender is fluid, right? That's part of the ideology, is to say that gender is fluid, and that some people may not recognize their gender until they're much older, or they may think that they are male, and then when they're 15 or 30 or 50 years old, they may recognize that they're female. And all of those identities have to be rubber stamped by the rest of society, by parents, teachers, doctors, therapists. Has to be rubber stamped. Now, mind you, Lisa, one of the many nonsensical parts of all this is that gender only seems to be fluid in one direction. So if you have somebody that announces that they are the opposite sex, well, then that gets a stamp of approval. But then if that same person in a few years decides that, I was mistaken, I had mental health issues, I learned a lot of misinformation, and I realize now that I can never be anything other than what my body is. And they go back to living as a boy or a girl, a man or a woman, then the transgender activists will say, oh, no, they were never transgender to begin with.
Oh, the damage is irreparable. And I've heard a lot of stories about people being kicked out of the community, completely abandoned and unsupported when they do detransition. And
demonized. No, much more than unsupported, much worse than that.
Oh yes, it just becomes more of a problem than it was to begin with. I wanted to go back to what alternatives, it shouldn't be an alternative, but what would be the preferred treatments for people suffering from certain types of body dysmorphia or gender dysphoria.
Okay, well, I didn't finish. I got a little sidetracked. Let me go back. You asked me about parents, and didn't you ask me what they can do with the young kids, or about protecting?
So when they're experiencing gender dysphoria, say a child thinks that they're suffering gender dysphoria or truly does feel that way, what do you suppose would be the right way to go about this type of thing in your practice, rather than going down the path of gender transition?
Okay, it is a complicated subject, but and every child and family is different, but I can give you these sort of basic guidelines. So number one is to be educated on the issue so that you're not caught, you're not sort of ambushed if your child does make this announcement. And it can happen in any family. There's no family that's immune. So it's imperative to know what this subject, is about and where it came from. And then, in terms of the child, what you want to do is to be supportive of the child, but not to affirm anything that is not true. So you want to affirm their emotions, because emotions are never wrong. If someone's angry or upset or sad or frustrated, it's not wrong. What's wrong is to have the idea that they may have been born in the wrong body. So parents have to know that they do want to, support and affirm their child's emotional difficulty that they're going through at the time, and not to just sweep that away and say, oh, that's just silly, or, I don't believe in all that, just forget about it. No, you don't want to do that at all. The opposite. You want to say, oh, and you want to give them your full attention. You don't do this while you're scrolling on your phone. You don't do it while you're washing the dishes. You do it when you can really give your full attention to your child. And, in my book, Lisa, I actually have an entire conversation, a model conversation between a parent and a child on this topic. And the highlight of that conversation, like I said, to give the child your full attention, because this is important. And let the child know that if it's important to them, it's important to you. And that you may not be an expert on this subject right now, but you plan to become an expert, because you can tell that it's important to them, and you're so glad that they came to you. At the moment, you don't know that much, but boy, you are going to go and read and ask questions and find the experts so that you're going to really understand this. It's going to take some time, but this is a process. So, when kids come and they say, I want you to use a different name and different pronouns, the parent should have curiosity, but not agree to it. At least I would say not immediately agree to it. There should be a lot of curiosity. What do you mean by when you say that you're not really a boy? When did you first start feeling this way? Tell me more about it. Have you talked to someone about it? Have you been on some website? Did you hear about it at school? And not in a way that is interrogating, but in a way that is just a loving curiosity. You want to know where the child heard about it. Now, Lisa, there are different kinds of gender dysphoria. Gender dysphoria meaning having an intense discomfort with your sex. And what I've been talking about with you so far is the type of gender dysphoria that we've been seeing, in an epidemic form in the past 8 or 10 years that is essentially occurring in mostly teenage girls. There are boys as well, but a majority seem to be girls. And these are girls who did not at an earlier age have discomfort with being a girl. In fact, they may have been extremely feminine and extremely girly. And the same for the boys. They may have been extremely masculine, typically, stereotypical boys. But these kids in general, have mental health issues. They have anxiety before the gender dysphoria. They have a history of depression, anxiety. Many of them are on the autism spectrum. And that's a population of kids that is very different from the population that we used to see, those very, very rare cases of kids who are 3, 4, 5 years old, and they are complaining to their parents and saying, I'm really not a girl, I'm a boy, I want to wake up tomorrow and have a penis. This is a different population. The first population, are you aware of Jazz Jennings?
I am aware of Jazz Jennings, yes.
Okay, so I'm bringing up Jazz because Jazz is kind of the poster child of a gender affirmed child who went through the entire process, the social affirmation, new name, pronouns at a very early age, and then medical and surgical procedures. So what I'm pointing out here is that those kids, those very rare kids like Jazz, who are presenting with gender dysphoria from an extremely young age, are in a different category than the current, skyrocketing numbers of teenagers. It's a different type of gender dysphoria. And I want to just point that out in case some of the people in the audience, because you're asking me how to handle your child. So there's a difference if your child is 3 years old and your child is 13 or 18 years old and coming to you with this announcement. There's a big difference. So again, we're talking about the older kids. Now, these older kids, because we essentially have never seen them prior to about 8 or 10 years ago, we don't have data on their long-term outcomes. And what's happening in the Western world, unfortunately, up until a few years ago, is that many countries were automatically, rubber stamping these new identities and putting these kids on an assembly line toward medical and surgical interventions. Now, that has changed in quite a few countries, such as Sweden, Norway, Finland, Britain, and they've actually changed, Denmark, their approach toward these kids, and they are saying psychotherapy is what they need, and that we don't have evidence of long-term benefit from puberty blockers, cross-sex hormones, or surgeries in minors. We simply don't have it. We do have evidence of harm. And so those countries have done a U-turn, a 180, and they're no longer making those interventions available, whereas in countries like the US and Canada, and I believe in Australia as well, you can tell me, those interventions are available after one visit. You might be 10 years old and you can get puberty blockers after one visit.
Oh, I'm hearing that they're quite readily available online. People don't even need to see a doctor to purchase cross-sex hormones. So that's a little bit concerning. That brings me to my next question about the dangers of the cross-sex hormones, the more specifically the type that creates fake lactation in men who identify as trans women when there's babies involved. Can we talk a little bit about that?
I mean, this is a very difficult topic. Just so disturbing. What you're speaking of, Lisa, of course, is men who I think it's fair to say that they have a fetish, a sexual fetish in which they want to be able to, what they're calling, nurse or feed an infant. And what happens is that these men who identify and call themselves and want the world to call them women are given a ton of medications, hormones, chemicals that cause them to have technically what it should be called is a discharge, an abnormal breast discharge. What is in that discharge, only God knows. But these men are then believing, they're putting a newborn, to their nipples. A newborn is just automatically going to suck, as you know, that's a reflex. I mean, a newborn will suck on almost anything. So they are calling what they're doing chest feeding. And, Lisa, let me put it this way. We've always had people in society who are emotionally disturbed. That's nothing new. But when we have our government health authorities, such as in the United States, we have the Center for Disease Control, CDC, and they are actually telling medical providers that if you have patients who wish to be able to, men who wish to lactate, meaning to produce breast milk, although what they're producing I would not call milk, but the CDC says you need to be aware that this is an option for your patients. So in other words, they're giving it their stamp of approval. And my question is, who is going to speak for the babies? We know that the adults are happy and getting off on doing this and posting on X pictures of, an infant ingesting this chemical brew, which they're calling breast milk or chest milk. Who is going to stand up on behalf of the children, the babies? I mean, they're newborns. We have so many organizations, so-called children. Look at UNICEF, the branch of the United Nations, that is constantly coming out and speaking up, for children all over the world, no matter what the situation, during war, refugees, whatever it may be, the children of Somalia, the children in Gaza. Well, where is UNICEF, their statement about the dangers to newborns of ingesting this brew of chemicals, whose God knows what's in there. That's all I'm going to say. Only God knows what's in there. And I'm a mother and a grandmother, and and you have children. I know that you're a mom, and you know that moms, when we find the moment, even before we find out that we are pregnant, we are so careful, right, about what we allow into our bodies. Not every single mom. I know there's moms that are drinking and smoking and using substances, but the vast majority of responsible women, when we find out that we are pregnant, we are afraid, right? Can I eat that? Can I drink that? Is this okay? Can I use, you know, deodorant? Can I, whatever it is, right? We're like hyper. Can I expose my fetus, my baby
Certainly
to this?
every day. And being
Right,
around different people, the different environments, even being around secondhand smoke. Yeah, right. Like mothers are generally a lot more careful during that pregnancy time and newborn and lactating time. So it's just
exactly.
unimaginable and enraging to think that these newborns are not only being deprived of the most important a substance that they really need, which colostrum. We all know the
Yes.
benefits of breastfeeding, and unfortunately, some mothers, for whatever reason, might have difficulty doing that. But the damage that could be done because of the chemicals with these cross-sex hormones and what's creating what you're calling a concoction of God knows what damage could be done long term for these babies and
Right.
psychological damage. I mean, I just can't imagine the situation and how they're going to explain this. It's happening on a mass scale as well, and very rapidly becoming normalized amongst that community.
Well,
So
Lisa, I have part of my book with which I have a chapter on what is euphemistically called top surgery, which is the bilateral mastectomies in girls that are being performed, by the way, that have been performed on girls as young as 12 or 13. We have evidence of that. And I talk in that chapter about how young women, girls, need to be educated about the incredible, awesome wonders of the female body, including the awesomeness and wonders of nursing. And of course, not everyone is going to choose to nurse, as you know, and not everyone will be able to nurse, Lisa, but it is the gold standard. And there's a reason why it is the gold standard. It's held up by, the pediatricians, the World Health Organization, um, you name it. It is the gold standard. Colostrum being the very first, earliest milk that is produced for the baby to consume. It is just packed with every single sort of, nutritional benefit, supplement, immune booster. It is just gold, magical, liquid gold. Let's call it that, liquid gold
liquid
for.
gold, and nothing can replace that. I mean, of course, we do have things like formula and uh, those sorts of things they might offer to mothers who are unable to physically breastfeed for whatever medical reason there might be. But as you said, it is liquid gold and an essential for especially newborns.
It absolutely is. And to say nothing, Lisa, of the maternal child bonding that occurs during the nursing process. And we know that oxytocin, which is a primarily a female hormone that is released uh, during during nursing, and that affects the brain of the mother and the child, and it helps them both to relax and to bond and to create feelings of attachment and trust and all those wonderful things happens during nursing. Okay, and this is science that I really wish that our girls were being told, instead of being taught that they may have been born in the wrong body, and they may just want to have their breasts amputated when they get older.
They are certainly taken away one of the most greatest of God's gifts to all children involved in this sort of ideology that get lured into it. And I'll use the word lured because it's quite evident that that's what they are doing in mainstream schools, all over mainstream media, the school libraries, TikTok, big tech, everything supports it. Everywhere you go, it's just down their throats. There's almost no escape from this negative influence. I'll call it what it is, but it's a
Well,
rabbit hole of confusion for young, impressionable minds.
yes, it is. It's very dark, and it leads to irreversible harm. It can, lead to lifelong sexual dysfunction and sterility, obviously. So it's very dark. But, I think we're going to be winding down. I want to leave your audience on a note of optimism. One note of optimism, of course, is that kids can be brought out of it, and many kids do leave this sort of cult-like social movement. And I explain in my book how that can work, and I give examples from my practice of kids that did leave that confusion, and they found themselves and reached a sense of comfort and a sense of peace with who they are, with their physical reality. So people should feel hopeful about that. But not only that, but there's almost every day now, there's news stories and revelations and whistleblowers and studies that are being brought out that are going to bring all of this down. It is coming down, and it's coming down pretty fast. Now, your mainstream media in Australia may not be covering it all, and I hope that you have access to media that is covering it. I encourage people to go to my website, miriamgrossmanmd.com, and there's a lot of fantastic information for you, including other interviews, videos. I testified in Congress on this issue. There's, articles that I've written, and then I have a resource page for parents and others with many different, links to organizations, support groups, books for children. There's beautiful books for children that have come out in 7 different languages, I think they are. So there's ways that you must inoculate your family. It's something that responsible parents have to do so that they're not caught unaware. Once your child is pulled into this cult, it can be very rough to
As
get
they
them out.
say, knowledge is power, and prevention is always better than a cure. So for those who have not read Lost in Transnation, please see the website in the bio, and it's a must read by Dr. Miriam Grossman. Thank you very much for your time today, and I look forward to hearing more of your work in the future.
Thank you, Lisa. I'll just add something, and that is that I'm aware not everyone can sit down with a book, 300-page book. And so there's an audio version, which I actually did the narration of the audio version. And I know I've been told by many people that it's always best when the author does their own narration of their own book. And I became rather passionate during certain times while I was doing that narration, and people are enjoying it. So thank you, Lisa, for having me. And thank you for all you're doing to protect kids and families.
Well, my pleasure. It's been an absolute honor to speak with you today. Thank you, Dr. Miriam.
You're welcome.